Welcome back to Saturday Breakfast. An Australasian-wide conference to tackle child obesity has been held for the first time here in New Zealand. With 1 in 5 Kiwi kids overweight and 1 in 12 obese, the meeting could have come sooner. One keynote speaker says that the diet and exercise choices that a woman makes during her pregnancy has a big impact on their child's ongoing health. Director of the Liggins Institute at Auckland University, Professor Wayne Cutfield, joins me now. Wayne, welcome to the show. Is this new news? Is this new research?
It's adding to the news and the story, Tamati, that the obesity epidemic, and you've just mentioned it, doesn't begin in adult life, doesn't begin in childhood. It actually begins much earlier than that. In fact, it goes right back to a time a woman is thinking of getting pregnant. And during that critical phase during fetal life. And we know that children who are born too early, too late, too small, and in New Zealand too big, are all at risk of later diseases such as obesity and diabetes.
Right. You were talking about a vicious cycle, though.
Yes.
Talk me through that, because I think our viewers might find that interesting.
We are in what is described as a vicious obesity cycle. In other words, we have an overweight or an obese young woman who then gets pregnant and continues a diet which is high in calories, high in fat, and she's overfeeding effectively her fetus, which becomes fatter. She gives birth to a large baby who becomes an overweight child, who becomes an obese young woman, and on the cycle goes. And that cycle needs to be broken. And a good starting point is right at the beginning, before a woman or just as a woman becomes pregnant.
Right. So the ideal scenario would be that before you even find out that you're pregnant, you're already taking steps to ensure that you're leading a good, healthy lifestyle filled with exercise.
Absolutely. There's some information, though, Tamati, which is slightly unsettling from the UK and New Zealand, suggesting that women who become pregnant don't necessarily improve their diets. Their diets remain poor, as do their activity levels. And we know from data in New Zealand that diet leading up to the time of conception is often not ideal. And I think often women think that pregnancy isn't important until they get that positive pregnancy test. But in fact, the potential risks to their baby begin before that, in the weeks and months leading up to getting pregnant.
Okay. Talk me through, for example, Pacific Island culture, because so we've got lots of Pacific Islanders here in New Zealand. They're a big culture, almost the biggest on earth, I think some might even say. Are they destined to have big children and be part of that vicious cycle? Absolutely,
and they're at very high risk of that vicious cycle. So in other words, those risks are amplified at each stage in terms of obese young women and providing much more nutrients to their fetuses during pregnancy for much bigger babies, and on that cycle goes. So it affects all New Zealanders, but you are right, for Pacific Island families it's a huge deal.
Okay, what are you trying to get out? What's the message that you're trying to put out there?
The message, Tamati, is that women need to think about their diets and activity levels, not just when they're pregnant, but leading up to pregnancy, because that is critical in looking after the long-term health of their children, right through the rest of their lives, right through those children's lives into adult life.
Okay, today's the last day of the conference, yeah?
Yes,
you're doing a bit more speaking on that?
Yes, again, I'm being recycled again today.
Okay, well, hey, if it's good information, then it's not that bad. Thank you for joining us this morning. Professor Wayne Cutfield, Director of the Liggins Institute at Auckland University.
They often say about pregnancy, don't they, oh, I'm eating for two, but I think you can take that too far, can't you?
Yeah, and I was saying before to Wayne that when I was at the gym, there was an aerobics instructor. She used to do the body attack classes, and she was heavily pregnant, yet she was still up there on the stage doing it, and it made us all feel really uncomfortable as participants in the class. Yet if we're going by what Wayne was saying, perfect scenario, that kid's going to grow up to be this fit, young, healthy kid. Anyway,
Food for thought.